Question 1. A practical nurse is caring for a client with a new prescription for an ACE inhibitor. Which of the following findings would be most concerning and require immediate follow-up? A. Mild dry cough. B. Blood pressure of 130/85 mmHg. C. Serum potassium level of 5.5 millimoles per liter. D. Complaint of fatigue. Answer: C. Serum potassium level of 5.5 millimoles per liter. This question assesses knowledge of medication side effects, specifically for ACE inhibitors, and the importance of recognizing critical laboratory values. The key concern is the serum potassium level. ACE inhibitors can cause hyperkalemia, elevated potassium, and a level of 5.5 millimoles per liter is above the normal range and potentially dangerous, requiring immediate intervention. While a dry cough is a common and expected side effect, and fatigue or a blood pressure of 130/85 mmHg might be noted, hyperkalemia is a life-threatening adverse effect that takes priority. Always prioritize electrolyte imbalances when they are outside of the normal range and related to a medication's known side effect. Question 2. A client is admitted to the hospital with acute diverticulitis. Which diet would the practical nurse anticipate being ordered initially for this client? A. High-fiber diet. B. Clear liquid diet. C. Low-residue diet. D. Regular diet as tolerated. Answer: B. Clear liquid diet. This question tests understanding of therapeutic diets for specific gastrointestinal conditions. For acute diverticulitis, where the bowel is inflamed and needs rest, a clear liquid diet is typically ordered first to minimize irritation and allow the bowel to heal. A high-fiber or regular diet would be contraindicated during the acute phase as they would exacerbate inflammation, and while a low-residue diet might be used later in recovery, the initial management focuses on bowel rest. Remember that the goal in acute inflammation is to reduce irritation, so a clear liquid diet is the safest initial approach. Question 3. The practical nurse is providing discharge teaching to a client with new onset type 2 diabetes mellitus. Which statement by the client indicates a need for further teaching? A. I will check my blood sugar at least once a day. B. I should eat a consistent amount of carbohydrates at each meal. C. I can stop taking my medication if my blood sugar levels are normal. D. I need to increase my physical activity gradually. Answer: C. I can stop taking my medication if my blood sugar levels are normal. This question focuses on client education for managing type 2 diabetes mellitus and identifying misconceptions. The most concerning statement is the client's belief they can stop medication when blood sugar levels are normal, as this indicates a lack of understanding about the chronic nature of diabetes and the importance of continuous medication adherence for long-term control. Blood sugar normalization often results from medication and lifestyle changes, and stopping medication could lead to dangerous hyperglycemia. Emphasize that diabetes is a lifelong condition requiring ongoing management, even when symptoms are not present. Question 4. A 78-year-old client with a history of heart failure reports sudden onset of shortness of breath and frothy pink sputum. The practical nurse's priority action should be to: A. Administer prescribed furosemide. B. Place the client in a high Fowler's position. C. Obtain a 12-lead electrocardiogram, ECG. D. Auscultate lung sounds. Answer: B. Place the client in a high Fowler's position. This question assesses priority setting in an acute respiratory distress situation, likely acute pulmonary edema due to heart failure. The keywords sudden onset shortness of breath and frothy pink sputum strongly suggest pulmonary edema. The immediate priority is to improve the client's breathing and reduce venous return to the heart. Placing the client in a high Fowler's position achieves this by promoting lung expansion and decreasing fluid shift into the lungs. while administering furosemide, obtaining an ECG, and auscultating lung sounds are all important actions. Optimizing the client's breathing comes first in an acute respiratory emergency. Question 5. The practical nurse is preparing to administer medications to a client via a nasogastric (NG) tube. What is the most important initial action the nurse should take? A. Crush all medications into a fine powder. B. Flush the NG tube with 30 milliliters of water. C. Check the placement of the NG tube. D. Aspirate gastric contents for residual volume. Answer: C. Check the placement of the NG tube. This question tests the safe administration of medications via an NG tube, highlighting the crucial initial step. The most important initial action is always to verify the placement of the NG tube to ensure medications are delivered to the stomach and not the lungs, which could cause aspiration pneumonia. While flushing the tube, crushing medications, if appropriate, and checking residual volume are also parts of the process. They follow confirmation of correct tube placement. Always remember that patient safety regarding tube feeding or medication administration starts with verifying tube location. Question 6. A client undergoing chemotherapy for cancer develops stomatitis. Which intervention would the practical nurse include in the plan of care? A. Encourage consumption of acidic foods and beverages. B. Provide oral care with an alcohol-based mouthwash. C. Offer soft, bland foods and cool liquids. D. Advise brushing teeth vigorously after each meal. Answer: C. Offer soft, bland foods and cool liquids. This question addresses nursing interventions for stomatitis, a common side effect of chemotherapy characterized by inflammation and sores in the mouth. The goal is to minimize irritation and promote comfort. Offering soft, bland foods and cool liquids helps to reduce pain and discomfort during eating and drinking. Acidic foods, alcohol-based mouthwashes, and vigorous brushing would all irritate the inflamed mucosa and worsen the stomatitis. Always prioritize gentle oral care and soothing dietary choices for clients experiencing oral mucositis. Question 7. A mother brings her 4-month-old infant to the clinic for a well baby checkup. Which developmental milestone would the practical nurse expect the infant to demonstrate? A. Sits unsupported. B. Begins to stand with assistance. C. Rolls from back to front. D. Says mama or dada with meaning. Answer: C. Rolls from back to front. This question assesses knowledge of typical infant developmental milestones. At 4 months, infants are typically developing head control and beginning to roll, particularly from back to front. Sitting unsupported is usually achieved closer to 6 to 8 months, standing with assistance later still, around 9 to 12 months, and saying meaningful words like mama or dada is a language milestone expected around 9 to 12 months or later. Understanding age-appropriate milestones helps nurses assess healthy development and identify potential delays. Question 8. A client has returned from surgery with a new colostomy. The practical nurse observes the stoma is dusky and purple. What is the most appropriate action? A. Document the finding and continue to monitor. B. Apply a warm compress to the stoma. C. Notify the primary care provider immediately. D. Reapply the colostomy bag ensuring a tight seal. Answer: C. Notify the primary care provider immediately. This question focuses on recognizing and responding to a critical finding in a postoperative colostomy client. A dusky, purple stoma indicates compromised blood flow or ischemia, which is a medical emergency and could lead to stoma necrosis. This finding requires immediate notification of the primary care provider, as it may necessitate surgical intervention. Documenting and monitoring, applying a warm compress, or reapplying the bag do not address the urgency of potential tissue death. Always remember that color changes in a stoma, especially dusky or purple hues, are red flags. Question 9. The practical nurse is caring for a client receiving continuous intravenous fluids. The client suddenly develops crackles in the lungs, dyspnea, and peripheral edema. These signs most likely indicate which complication? A. Hypovolemia. B. Fluid volume excess. C. Allergic reaction. D. Septic shock. Answer: B. Fluid volume excess. This question tests the recognition of signs and symptoms related to fluid balance imbalances. The constellation of crackles in the lungs, pulmonary edema, dyspnea, difficulty breathing, and peripheral edema, swelling in extremities, are classic signs of fluid volume excess, often due to too much intravenous fluid, especially in clients with compromised cardiac or renal function. Hypovolemia presents with dehydration signs. An allergic reaction would have different symptoms like rash or anaphylaxis, and septic shock involves signs of systemic infection and circulatory collapse. Connecting these specific symptoms to fluid overload is key. Question 10. A client with an indwelling urinary catheter complains of lower abdominal pain and a strong urge to void. What is the practical nurse's initial action? A. Administer a prescribed analgesic. B. Check the catheter for kinks or obstructions. C. Irrigate the catheter with sterile saline. D. Obtain a urine sample for culture and sensitivity. Answer: B. Check the catheter for kinks or obstructions. This question assesses the initial nursing action for a client with an indwelling catheter experiencing discomfort and a strong urge to void. The most common and easily correctable cause for these symptoms in a catheterized client is an obstruction, e.g., kink in the tubing, sediment blocking the lumen, which prevents urine drainage and causes bladder distension. Checking for and resolving an obstruction is the immediate priority to relieve the client's discomfort. While other actions like analgesics, irrigation, or urine culture may be necessary later, ensuring the catheter is patent is the crucial first step. Question 11. The practical nurse is caring for a client who is NPO, nothing by mouth, for surgery. The client asks for a sip of water due to dry mouth. What is the most appropriate response? A. Just a small sip won't hurt, but don't tell anyone. B. I understand you're thirsty, but it's important to remain NPO for your safety. C. I will get you some ice chips instead, as those are usually allowed. D. You can have a sip of water, but nothing else until after surgery. Answer: B. I understand you're thirsty, but it's important to remain NPO for your safety. This question assesses the nurse's understanding of NPO status and therapeutic communication. Maintaining NPO status is critical before surgery to prevent aspiration during anesthesia, making client safety the paramount concern. The most appropriate response acknowledges the client's discomfort while firmly explaining the rationale for the NPO order, reinforcing the importance of compliance for their safety. Offering ice chips or allowing a small sip would violate the NPO order, and encouraging secrecy is unethical. Always prioritize patient safety and provide clear, truthful explanations. Question 12. A client is prescribed digoxin for heart failure. The practical nurse should withhold the medication and notify the physician if the client's apical pulse rate is less than A. 70 beats/minute. B. 60 beats/minute. C. 50 beats/minute. D. 40 beats/minute. Answer: B. 60 beats/minute. This question tests knowledge of specific medication parameters for safe drug administration, particularly for cardiac glycosides like digoxin. Digoxin slows the heart rate, and administering it when the apical pulse is less than 60 beats/minute in adults can lead to profound bradycardia or other arrhythmias, increasing the risk of digoxin toxicity. Therefore, the nurse must always check the apical pulse for 1 full minute before administering digoxin and withhold the dose if it is below the established parameter, notifying the physician. Remember to always check the apical pulse before giving digoxin. Question 13. The practical nurse is caring for a client with a new peripherally inserted central catheter, PICC. Which action is essential to prevent complications related to the PICC line? A. Change the dressing daily using clean technique. B. Flush the PICC line with normal saline every 24 hours. C. Avoid using the PICC line for blood draws. D. Secure the tubing with adhesive tape directly over the insertion site. Answer: B. Flush the PICC line with normal saline every 24 hours. This question addresses the essential maintenance of a PICC line to prevent complications. Regular flushing with normal saline, or heparinized saline, depending on policy, is crucial to maintain patency and prevent clot formation within the lumen, which could lead to occlusion or infection. Dressing changes are typically done less frequently than daily, e.g., weekly or when soiled, using sterile technique, not clean technique. While blood draws can increase the risk of occlusion if not done properly, avoiding them altogether is not an essential preventative measure for line patency. Taping directly over the insertion site is generally avoided to allow for assessment and prevent skin irritation. Question 14. A client experiencing severe anxiety is hyperventilating. The practical nurse should first instruct the client to A. Breathe into a paper bag. B. Take deep, slow breaths. C. Distract themselves with a television show. D. Drink a glass of water. Answer: B. Take deep, slow breaths. This question addresses the immediate intervention for hyperventilation caused by anxiety. The primary physiological issue in hyperventilation is blowing off too much carbon dioxide, leading to respiratory alkalosis. Encouraging slow, deep breaths helps the client re-establish a normal breathing pattern and retain carbon dioxide. While breathing into a paper bag was historically used, current recommendations emphasize controlled breathing techniques due to risks associated with the paper bag method, e.g., in clients with certain cardiac or respiratory conditions. Distraction or drinking water do not directly address the respiratory issue. Question 15. The practical nurse is providing education to a group of older adults about fall prevention at home. Which recommendation is most important? A. Wear loose-fitting clothing to allow for easy movement. B. Keep all rooms brightly lit at all times. C. Use throw rugs on hardwood floors for comfort. D. Remove clutter and ensure pathways are clear. Answer: D. Remove clutter and ensure pathways are clear. This question focuses on environmental modifications for fall prevention in older adults, emphasizing the most impactful intervention. Removing clutter and ensuring clear pathways directly addresses trip hazards, which are a major cause of falls in the home. While good lighting is important, brightly lit at all times might be excessive or impractical. Loose-fitting clothing can sometimes increase fall risk, e.g., tripping over long hems. Throw rugs are a significant fall hazard and should be removed or secured, not encouraged. Prioritizing a clear, hazard-free environment is fundamental to fall prevention. Question 16. A client presents with a sudden onset of unilateral weakness, facial droop, and slurred speech. The practical nurse recognizes these as signs of a potential A. Myocardial infarction. B. Transient ischemic attack, TIA. C. Hypoglycemic reaction. D. Cerebrovascular accident, stroke. Answer: D. Cerebrovascular accident, stroke. This question tests the recognition of classic signs of a cerebrovascular accident, CVA, commonly known as a stroke. The sudden onset of unilateral weakness, one-sided weakness, facial droop, and slurred speech, dysarthria, are hallmark symptoms captured by the FAST acronym: face drooping, arm weakness, speech difficulty, time to call emergency services, and are indicative of a neurological event like a stroke. While a TIA presents similarly, it is a temporary event. The description here points to a stroke, which is a medical emergency requiring immediate attention. Myocardial infarction involves cardiac symptoms, and hypoglycemia would present with altered mental status, sweating, and tremor, but not typically focal neurological deficits like unilateral weakness. Question 17. The practical nurse is reinforcing teaching for a client with asthma on the proper use of a metered dose inhaler, MDI. Which statement by the client indicates effective learning? A. I will shake the inhaler and then immediately inhale as I press down. B. I will take a deep breath, hold it, and then inhale the medication. C. I will exhale fully, activate the inhaler, and then inhale slowly and deeply. D. I should always rinse my mouth immediately after using the inhaler. Answer: C. I will exhale fully, activate the inhaler, and then inhale slowly and deeply. This question evaluates the client's understanding of correct MDI technique, which is crucial for medication effectiveness. The correct technique involves exhaling fully first, then activating the inhaler while slowly and deeply inhaling the medication to ensure it reaches the lungs effectively. Rinsing the mouth is recommended after corticosteroid inhalers, but not all MDIs, and isn't part of the core inhalation technique itself. Taking a deep breath before exhaling or immediately inhaling without prior full exhalation would lead to poor drug delivery. Proper MDI use maximizes medication absorption and therapeutic effect. Question 18. A client is diagnosed with Clostridioides difficile, C. diff, infection. What is the most important infection control measure the practical nurse should implement? A. Place the client in a private room with negative pressure airflow. B. Ensure all staff wear an N95 respirator mask when entering the room. C. Use alcohol-based hand sanitizer before and after client contact. D. Wash hands thoroughly with soap and water after providing care. Answer: D. Wash hands thoroughly with soap and water after providing care. This question tests knowledge of infection control for C. diff. Unlike many other pathogens, C. diff spores are resistant to alcohol-based hand sanitizers, making thorough handwashing with soap and water the single most effective method to prevent its spread. Private rooms are typically used, and contact precautions, gown and gloves, are implemented, but negative pressure airflow is for airborne pathogens like tuberculosis. N95 respirators are also for airborne precautions. Emphasize proper hand hygiene as the cornerstone of C. diff prevention. Question 19. The practical nurse is assessing a client's pain level. The client rates their pain as an 8 out of 10 on a pain scale, but appears calm and is watching television. What is the most appropriate action by the nurse? A. Document the pain rating and continue to monitor. B. Tell the client that their pain rating does not match their appearance. C. Administer prescribed pain medication as ordered. D. Re-educate the client on how to use the pain scale correctly. Answer: C. Administer prescribed pain medication as ordered. This question addresses the principle of respecting a client's self-report of pain, regardless of observed behavior. Pain is subjective, and a client's reported pain level, 0.8, is the most reliable indicator, even if their outward appearance seems calm. Nurses must believe the client's self-report of pain and act on it. Dismissing their pain, re-educating them on the scale, or merely monitoring without intervention would be inappropriate and potentially unethical. Always trust the client's self-report of pain and administer prescribed medication to alleviate it. Question 20. A 6-year-old child is admitted with a fractured tibia. When explaining the injury and treatment, which approach is most appropriate for the practical nurse to take? A. Use complex medical terminology to ensure accuracy. B. Speak directly to the parents, as the child won't understand. C. Use simple, concrete terms and age-appropriate language. D. Show the child a detailed diagram of the bone structure. Answer: C. Use simple, concrete terms and age-appropriate language. This question focuses on effective communication with pediatric clients. When explaining medical information to a 6-year-old, it is crucial to use simple, concrete terms and language that matches their developmental level to ensure understanding and reduce anxiety. Using complex medical terminology would be confusing, and speaking only to the parents would exclude the child from their own care. While diagrams can be helpful, a detailed diagram of bone structure might be too complex or frightening for a 6-year-old. Always tailor communication to the child's cognitive ability. Question 21. The practical nurse is providing care for a client with a new prescription for warfarin. Which food item should the nurse advise the client to consume consistently rather than avoid entirely? A. Green leafy vegetables. B. Grapefruit juice. C. Cranberry juice. D. Alcohol. Answer: A. Green leafy vegetables. This question assesses understanding of diet-drug interactions, specifically with warfarin, an anticoagulant. Warfarin works by interfering with vitamin K-dependent clotting factors, and green leafy vegetables are high in vitamin K. Instead of avoiding them entirely, clients are advised to consume a consistent amount of vitamin K-rich foods to avoid fluctuations in warfarin's effect and maintain stable INR levels. Grapefruit and cranberry juice, along with alcohol, can increase warfarin's effect and should generally be avoided or consumed very cautiously with physician approval due to potential interactions. Consistency in vitamin K intake is key. Question 22. A client scheduled for a colonoscopy expresses fear and anxiety about the procedure. Which therapeutic communication technique would be most effective for the practical nurse to use? A. Don't worry, everyone gets nervous before procedures. B. What specifically about the colonoscopy is making you feel anxious? C. It's a simple procedure, you'll be fine. D. Would you like some medication to help you relax? Answer: B. What specifically about the colonoscopy is making you feel anxious? This question tests therapeutic communication skills, specifically focusing on anxiety. Asking an open-ended question like "What specifically about the colonoscopy is making you feel anxious?" encourages the client to express their feelings and helps the nurse understand the root cause of their anxiety. This allows for targeted interventions or education. Dismissing their feelings, "Don't worry, it's a simple procedure," is non-therapeutic. While medication might be an option, exploring the client's feelings first allows for a holistic and client-centered approach. Question 23. A client reports acute onset of severe, crushing chest pain radiating to the left arm and jaw. What is the immediate priority for the practical nurse? A. Obtain a detailed pain history from the client. B. Administer oxygen via nasal cannula. C. Prepare for immediate cardiac enzyme blood draw. D. Activate the emergency response system. Answer: D. Activate the emergency response system. This question presents a classic scenario indicative of a myocardial infarction, heart attack, and requires immediate prioritization. The symptoms described are life-threatening, and prompt activation of the emergency response system, e.g., calling a code blue or rapid response team, is the absolute priority to ensure the client receives advanced cardiac life support quickly. While oxygen administration, pain history, and blood draws are all important, they come after initiating the emergency response, which brings a team with the necessary expertise and equipment to the bedside. Question 24. The practical nurse is reinforcing teaching about self-care for a client newly diagnosed with type 1 diabetes. Which statement is crucial for the client to understand about insulin administration? A. I can inject insulin into the same spot every time to minimize discomfort. B. I should always rotate injection sites to prevent lipohypertrophy. C. Insulin should only be injected into the abdomen. D. I can skip a dose of insulin if my blood sugar is normal. Answer: B. I should always rotate injection sites to prevent lipohypertrophy. This question focuses on essential education for insulin administration in type 1 diabetes. The most crucial concept is site rotation. Rotating injection sites is vital to prevent lipohypertrophy, which is a lump or fatty deposit that can form under the skin from repeated injections in the same area, affecting insulin absorption and effectiveness. Injecting into the same spot, or only the abdomen, goes against this principle. Skipping a dose of insulin, even if blood sugar appears normal, is dangerous for a client with type 1 diabetes as they do not produce their own insulin. Question 25. A client diagnosed with obsessive-compulsive disorder, OCD, spends several hours a day performing hand-washing rituals. The practical nurse understands that this ritualistic behavior serves which primary purpose for the client? A. To gain attention from others. B. To punish themselves for perceived wrongdoings. C. To reduce anxiety and discomfort. D. To avoid responsibility for other tasks. Answer: C. To reduce anxiety and discomfort. This question assesses understanding of the underlying dynamics of obsessive-compulsive disorder, OCD. For clients with OCD, compulsive rituals, like excessive hand-washing, are performed primarily to alleviate or reduce the intense anxiety and distress caused by their intrusive, obsessive thoughts. While the behaviors might seem illogical to an observer, they serve as a coping mechanism for the client to manage overwhelming feelings. The rituals are not typically for attention, self-punishment, or avoidance of other tasks. Question 26. The practical nurse is caring for a client who is actively bleeding from a superficial wound on the arm. What is the most appropriate initial action? A. Apply a tourniquet above the wound. B. Elevate the affected limb above the heart. C. Apply direct pressure to the wound. D. Apply ice to the wound. Answer: C. Apply direct pressure to the wound. This question tests knowledge of immediate first aid for a bleeding wound. The most appropriate and effective initial action for controlling superficial bleeding is to apply direct pressure to the wound. This promotes coagulation and helps stop the blood flow. Elevating the limb can be a secondary measure but is less effective than direct pressure alone. A tourniquet is a last resort for severe, life-threatening arterial bleeding that cannot be controlled by other means, and ice can help with swelling but is not the primary intervention for active bleeding. Question 27. The practical nurse is assisting a client with ambulation after a stroke. The client has left-sided weakness. Where should the nurse position themselves? A. On the client's strong, right, side. B. On the client's weak, left, side. C. Slightly in front of the client. D. Slightly behind the client. Answer: B. On the client's weak, left, side. This question focuses on client safety and proper body mechanics during ambulation for a client with unilateral weakness. When assisting a client with one-sided weakness, the nurse should position themselves on the client's affected or weak side. This allows the nurse to provide maximum support and assist quickly if the client loses balance or falls towards their weaker side. Supporting the strong side would leave the client vulnerable to falls. Think of always guarding the fall risk side. Question 28. A client on a medical unit suddenly becomes confused and disoriented. The practical nurse notes the client's temperature is 38.8 degrees Celsius 101.8 degrees Fahrenheit, and urine appears cloudy. Which condition should the nurse suspect as the most likely cause? A. Hypoglycemia. B. Stroke. C. Urinary tract infection, UTI. D. Dehydration. Answer: C. Urinary tract infection, UTI. This question tests the recognition of common causes of acute confusion or delirium, especially in older adults. Acute confusion, fever, and cloudy urine strongly suggest a urinary tract infection, UTI, which is a very common cause of delirium and altered mental status in hospitalized or elderly clients, often without classic urinary symptoms. While hypoglycemia and stroke can cause confusion, the presence of fever and cloudy urine points specifically towards an infection. Dehydration might cause confusion but not typically fever or cloudy urine. Always consider infection as a cause of sudden mental status changes. Question 29. The practical nurse is preparing to administer an intramuscular, IM, injection to an adult client. Which muscle site is generally preferred for most IM injections due to its safety and accessibility? A. Deltoid. B. Dorsogluteal. C. Vastus lateralis. D. Ventrogluteal. Answer: D. Ventrogluteal. This question assesses knowledge of safe intramuscular injection sites. The ventrogluteal site is generally considered the safest and preferred site for most adult IM injections because it is free from major nerves and blood vessels, has a good muscle mass, and has a lower risk of injury compared to other sites. The dorsogluteal site is largely avoided due to the high risk of sciatic nerve injury. While the deltoid is used for smaller volumes, and the vastus lateralis is common in infants and children, the ventrogluteal is the preferred adult site due to its safety profile. Question 30. A client with chronic obstructive pulmonary disease, COPD, is prescribed oxygen therapy at 2 liters per minute via nasal cannula. The practical nurse understands that a key principle when administering oxygen to a client with COPD is to A. Maintain oxygen saturation above 95% at all times. B. Administer high-flow oxygen to relieve dyspnea quickly. C. Avoid oxygen administration due to the risk of CO2 narcosis. D. Administer oxygen cautiously to avoid suppressing the hypoxic drive. Answer: D. Administer oxygen cautiously to avoid suppressing the hypoxic drive. This question addresses a critical concept in oxygen therapy for clients with COPD. For many clients with chronic COPD, their respiratory drive is primarily stimulated by low oxygen levels, hypoxic drive, rather than elevated carbon dioxide. Administering high-flow oxygen can suppress this drive, leading to hypoventilation and potentially CO2 narcosis, carbon dioxide retention, and altered mental status. Therefore, oxygen must be administered cautiously, typically at low flow rates, to maintain adequate oxygenation without completely abolishing the hypoxic drive. Aiming for an SpO2 of 88 to 92% is often appropriate.